Good afternoon. We'll now start. First of all, I'd like to welcome everybody to this pep talk this afternoon. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and at the end of the pep talk, so please show your face in the video. Reminder, after the pep talk, please take the online learning curve evaluation test exercise or OLETE for mastery of learning and have a perfect score to get a certificate like this, the one shown here. I have placed the link in the chat box. Another reminder, obtaining 25 OLETE certificates will entitle one mentee to a one voucher for ROJoson medical consultation, either face-to-face or telemedical. This is the picture of the voucher which will be issued to the mentees who qualified for it. And then another request, please type in your feedback in the chat box during the open forum and before we adjourn. Let's now have a group picture taking before we start the pep talk proper in 2 minutes. Please show your faces now. Ready? One, one, two, three. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021 during the COVID-19 pandemic. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. And from October 23, 2021 onwards, I've been tackling health disorder and health issue courses. March 18 this year, 2024, marks the start of year number 4 for the ROJoson PEP Talk. How long the pep talk will last will depend on the enthusiasm, discipline, of perseverance of the participants, of the mentees, and myself, of course. My pep talk today is entitled Medical Anecdotal Report, MACROCYSTS of the Breast Management. The empowerment objective is for the lay people to have an essential understanding on macrocysts of the breast management as part of their health management. The contents of this particular pep talk will be the following. I will be defining what is a medical anecdotal report or MAR. And then this MAR will consist of 2 segments, narration, and then the insight and reflection. So the title of the MAR will be Macrocysts of the Breast Management. The reporter will be me, yours truly, and then the date of observation of this particular patient is this year, 2024. A disclaimer that I'd like to make is that this ROJoson's pep talk contains my thoughts, perceptions, opinions, and recommendations, or what I call TPORs, culled from my personal experiences as well as reading the writings of other health professionals, which I try to digest and then share it with you, whatever I think are valid. The gist of the MAR, let's start with the gist of the MAR. Gist means a summary of the MAR to give you an overview of what this MAR is this case is all about. So in 1995, a 47-year-old Filipina from Cavite consulted me for masses in both breast. She had two previous operations done by other surgeons, one in 1987, one in 1993, and another one in 1994. When I saw her in 1995, she was also presenting with another breast mass. My diagnosis was macrocyst, to which I said, no need for more operations, just needle aspirations at most, and then just observe. I told her the recurring macrocyst would eventually stop when she reached menopausal stage. She had recurrences every year from 1995 to 2002. That's for 7 years after I did my initial needle aspiration in 1995. I just did repeated needle aspirations with no operations. In 2002, the recurrence stopped. She was 50 years old then and menopausal. So from 2002 up to 2024, this year, that's 22 years, a total of 22 years, she had no recurrences. The macrocyst stopped at her menopausal stage. So I will be including, as part of the content, some reflections and learning points and issues. I'll be defining what is a macrocyst of the breast, what are the causes, what can macrocysts recur after needle aspirations and operations, and when do macrocysts stop recurring on their own. Then I'll give you some tips on management of similar situations. So what is a medical anecdotal report? This is operationally defined by myself, by yours truly, as a brief written report on an actual medical event or actual patient. This medical observation must have an impact on the reporter, which is me, in terms of insight or reflections gained, and which the reporter, which is me, thinks is worth sharing with other people, usually for learning purposes. So I'll be sharing here this to you because I know this will be important to be aware of and then to know what to do when you have such a macrocyst. The MAR have two parts. One is narration, the first part, and the second part is the insight or reflections. So let's start with the narration. So as I said, this is an actual case. That's why I also present the medical records here. Okay. So I just have to blur on the, for privacy purposes, I just blurred the name and some important data here. Okay. So in March 1995, CFI, patient's name, initial CFI, a 47-year-old female, Filipina from Cavite City, consulted me for masses on the right and left breast. Okay, so here, okay. So she had 3 previous operations, which is excision, removal of the breast masses, done by other surgeons in Cavite because she was from Cavite. So the first operation was done in 1987 at age 39, in 1993 at age 45, and then in 1994 at age 46. Okay. So here shown is the record, history of 3 excisions, 1987, 1993, 1994. So when she saw me on the next year, March 4, 1995, as a referral from other patients. So on physical examination, there were 3 masses, cystic on palpation. When you say cystic on palpation, it feels like it contains fluid. And then 2 on the right breast, here illustrated here, 2 on the right breast, and then 1 on the left breast. My diagnosis was macrocyst because of the cystic feel on palpation. So bilateral, meaning right and left breast. So what I did was a needle aspiration on the 3 masses, yielding 8 cc on one of the nodule on the cyst on the right side, and then 4 cc on the other cyst on the right side. Okay. I obtained serous fluid. When you say serous fluid, it's not bloody, it's yellowish, okay? Sometimes colorless, okay? So from the right macrocyst, and then 5 cc on the left side. So after the aspiration, there was complete disappearance of the mass. Okay. So this is an illustration of how a needle aspiration is being done, just using a syringe and then a needle, and then just poke in the needle into the cyst and then aspirate. So here shown is the aspiration of the yellowish fluid. So this is what we call serous fluid. So it's not bloody, it's not red. Okay, so if it's red, we don't call it serous fluid. Okay. So 1 week after the aspiration, there were no palpable masses already. So 1 week is March 11, 1995, no more masses. Okay. However, after 3 months, there was recurrence of the macrocysts. Here, okay, in June, so March, walang recurrence after the aspiration, and then in June, may recurrence na. Okay, so aspiration again yielded 3 cc from each of the macrocysts on the right and left breast. So right side meron, sa left breast meron. So I was able to aspirate 3 cc from each breast cyst. Now, from June 1995, that was the second aspiration, up to 2002, a total of 7 years, she would have recurrences of the macrocysts at the frequency of every 3 to 4 months. I would just keep on doing repeated needle aspirations with no recommendations to operate, unlike the other surgeons who operated on her, okay, 3 times in 1987, 1993, and 1994. But my recommendation, no need for an operation, just do repeated aspiration as needed. Okay? I told her the macrocysts would most likely stop once she reached menopause. I advise her to have regular monitoring and follow-up exam with me at the frequency of every 2 months initially, then every 3 months, every 6 months, from 1995 to 2002, total of 7 years. So in 2002, that was the year the macrocysts would stop recurring. So 7 years after the mass stopped recurring after the first consultation with me in 1995. And she was 54 at this time, 54 years old at this time in 2002 and menopausal. So during that time, nag-stop na yung macrocysts. So during these times with recurrences, repeated aspiration would be done as indicated. I usually aspirate the bigger cyst, the big cyst. The smaller cyst, we just observe. Okay. So patient was compliant with my advice for regular monitoring and follow-up as will be seen in the following medical records. So in 1995, October, okay, yung June, wala nang recurrence, pero October, wala rin recurrence. Ito, October 7. Then, nag-recur naman in March 1996, the next year, sa right breast. Okay. And then, just for observation, okay. So, in May, nag-recur yung macrocyst niya, May 1996. Okay, I aspirated 5 cc and 4 cc on 2 macrocysts on the right breast, wala sa left. Then, nag-recur ulit, evident recurrence in September 1996, 1 cc, nakuha ko rito, then on the right breast, and then 3 and 5 cc on the left breast. Again, another recurrence in May 1997, okay, which I just observed because maliit lang, 1 centimeter, and then 3 centimeter, I just observed, okay, for 3 months. And then in August, she came back, there was another recurrence, andun pa rin, okay. So, this is a different site, no? Okay. So 7 cc, I aspirated 7 cc of fluid on this right side, and then 3 cc on the 7 cc on the left side and then 3 cc on the 7 cc on the right breast. Okay. Now, 1998, the next year, January. So again, there was a recurrence on the right breast. Dito. Pero because of the size is so small, we just agreed to observe. Okay, nawala naman. Okay. And then in June 1998, again, there was a recurrence, 4 to 5 cc on the right breast. And then September 1998, right and left breast recurrence also. And then in December 1998, no recurrence. And then in 1999, dito na, March 1999, there was 5 cc recurrence here. Okay. So July naman, 1999, again, maliit lang yung mga macrocysts niya. I just observed. And then 1999, maliit pa rin. In-observe ko lang. And then March 2020, because of its big size, I just have to aspirate it. Okay? In March 2000. Now, nag-recur naman ulit in May 2000, then September 2000, then January 2011, but the macrocysts were small, so we just observed. And then nung January and June 2001, okay, so ito, June 2001, we just aspirated all the macrocysts. And then on August 2002 up to February 2003 and July 2003, minomonitor lang namin, walang recurrence, no recurrence. Okay. So there was no recurrence from March 2004, October 2004, May 2005, February 2006, April 2007. So note the follow-up here because halos hindi nagre-recur. So the follow-up period is mahaba na. Every 6 months na. No? Then I was also suggesting pwedeng 12 months follow-up na. No? Okay. So December 2008, wala pa rin recurrence. Then July 2009, walang recurrence. So the follow-up here, nakita niyo 1 year after. Okay. Kasi I was expecting na bihira na mag-recur. Baka hindi na siya mag-recur. Okay. So last check-up, the latest check-up was this year, October 8, 2004. That was about last month. Again, up to now, there was no recurrence of the macrocyst. She was pointing to me a possible recurrence here during the checkup, pero when I palpated it, wala naman. Okay? So sa pina-ultrasound ko, no, just to check, wala rin. No? So in short, from 2002, the first time na hindi na siya bumabalik, no? Na hindi na nagre-recur, up to 2024, okay, after 22 years, walang revision, walang recurrence. So that's the end of the narration. So again, the gist of this MAR is that in 1995, first time the patient saw me, so this 47-year-old Filipina, okay, consulted me for breast masses on both breasts, right and left. She had 3 previous operations done by other surgeons, 1987, 1993, 1994. So when I saw her in 1995, my diagnosis was macrocysts. I don't know what diagnosis was given to her by the other surgeons. But for me, I told her no need for more operation. So stop the operations. Okay? Just needle aspirations at most and then observe. So I told her it might recur, okay, but the recurrence would eventually stop when she reaches menopause. She had recurrence, true enough, she had recurrences from every year from 1995 to 2002 for 7 years. So that was after I did my first initial aspiration in 1995. So what I did was just repeating the needle aspiration as we observe. Kung malaki, tanggal. Kung maliit, observe. So in 1992, nag-stop na yung recurrence. At that time, she was 54 years old. Okay, true enough, she was, huminto na siya when she was in the menopausal stage. So these are some of my reflections and my sharing of learning points for you. What is a macrocyst of the breast? Macrocysts are fluid filled. May laman ng fluid yung masses in the breast. Okay? Basta walang hindi dugo, fluid filled. Okay? The breast cysts may be defined by their size. May micro and macrocysts. Microcysts, maliit. Macro, malaki. Okay? So, microcysts are too small. These are the cysts which are too small to be felt. Hindi makakapa ito kasi masyadong maliit. But it's existing. Andyan sila. Okay? So, but this cannot be discerned by the palpating fingers. But they can be discerned by the ultrasound. Kung sa ultrasound, kaya makita, sa kamay, mahirap makita yung makapa yung macrocyst, microcyst, no? Kasi masyadong maliit. Okay? And usually when you say microcyst, the size is usually less than 1 centimeter in size, which is usually not palpable by the examining finger of any doctor, unless Superman siya. So, but, okay, macrocyst naman, so these are diseases that can be felt and discerned by the palpating finger, yung makakapa. So kung makakapa yung cyst, we call that macrocyst, malaki. Okay. But the size of the macrocyst can range from different sizes, which we can classify them as to, in generic terms, just call it small or big. Pero usually, pag palagi tinatanong, ano ba yung maliit, ano ba yung malaki? No? Okay. So usually when you say 1 centimeter lang or a little bigger, okay, baka small yon. Here, I have some definitions here. No? Okay. So, but the macrocysts can come out in any size. No? Pwedeng 1 centimeter, 2 centimeters, 3 centimeters, 4 centimeters, 5, or even bigger. Kung minsan 10, kung pinabayaan lang, so siya nawawala. No? Okay. So, as I said, a lot of patients, even among doctors, there's no universal agreement on what size constitute a small or big or medium macrocyst. Maraming tatanong, malaki na ba? Maliit pa ba? Even doctors, ang sagot na very subjective sila. So, but my personal recommendations, no, para mag-guide ko lang yung what to do, when to observe, when to operate, no? So, my personal recommendation is that if it's 4 to 5 centimeters by palpation, kung nakakapa by palpation and by ultrasound, I consider that as big already. Okay? So, more than 5 centimeters, definitely big siya. So yan ang pwedeng these are this size will be an indication for aspiration na. Now 1 to 2 centimeters lang, we can consider that as small, 1 to 2 centimeters. Kung 3 to 4, so medium size, no? Or we just call it moderate big. Okay. So 1 to 2 is small, 3 to 4 medium, and then more than 4 centimeters na lang, okay? We'll just call it big, and then definitely big, more than 5 centimeters. So ang usual indications for this will be when it's yung 3 to 4, pwedeng pang i-observe if there's no pain, no problem, no? Paulit-ulit lang. Pero yung usually pag initial evaluation, kung 3 to 4, usually ina-aspirate mo na just to check kung talagang macrocyst. Kung 1 to 2 centimeters lang, pwedeng i-observe. Now, kung big na, or definitely big, 4 to 5 centimeters, okay, usually ina-aspirate. But there are exceptions to the rule. Kung minsan ayaw ng pasyente, no? Kung minsan wala naman siya nararamdaman, okay, it can be observed. Basta importante may close follow-up by a breast specialist. Now, what are the causes of macrocysts of the breast? The exact cause is not yet known, but the commonly accepted hypothesis is that it is related to hormonal changes and part of the processes of aberration in normal development and involution. As we know, as a human being, we have a lot of bodies, the organs and tissues which keep on developing. Okay, so development, no? Development, it's either for maturation, yung iba naman, development into aging process, and then kumisan merong yung pag may normal aging, we consider that when there's an aging process, we still consider that as normal, no? So kung merong mga abnormality dun sa processes of development and aging or involution yung kumisan nawawala, no? Okay. So we call that ANDI. Okay, ANDI stands for A stands for aberration, normal, and normal, D development, and then involution I. Okay, so I think for the moment this is just applicable. This term is applicable being used for breast, mga breast like macrocysts, ganon, no? Pero I think personally, I think this could also be used for mga thyroid and other processes in the other parts of the body. So I will be exploring on this para magamit yung term kaysa sabihin natin na yung isang condition ay disease. Yung pala, normal aging processes lang yon, no? Para hindi matakot yung mga pasyente, no? So since this is related to hormonal changes and part of the processes of ANDI, it is not a disease. Hindi siya sakit. Okay? So it is part of a fibrocystic changes, which is hormonal changes. And then nakikita niyo the one part of the term fibrocystic, there's a suffix there, okay, cystic, no? So this is when you say fibrocystic, yung cystic na andito sa pangalan, it refers to the microcyst, yung maliliit, no? So, but this one can become big, no? More than 1 centimeter, and then we call that macrocyst already. Magiging palpable na siya. So again, to repeat, it is not a cancer. It is not a cancer. It is not a cancer. Huwag kayo matakot. Okay? So it typically occurs between 30 to 50 years old and before menopause. If it is recurrent, paulit-ulit, kadalasan, okay? So it may disappear spontaneously even before menopause or at menopause. So only time will tell what will happen. But kung macrocyst, you just wait. Okay? And then, hintayin mo na lang yung menopause mo. Hopefully, before menopause, mawala na. Kasi we also don't know when and when the menopausal stage will set in. Iba-iba yung mga babae, no? So as I said, it usually stops occurring and recurring when menopause is reached. How are macrocysts diagnosed? So clinically means by history and palpation, no, by physical examination, by the doctor usually, okay? So usually by palpation, ang pinaka-reliable na method of diagnosing a macrocyst clinically. So may makakapa ng bukol. So when say macrocyst, makakapa, di ba? So may makakapa ng breast mass, and then meron siyang fluctuancy sign, which connotes fluid. Okay? Then as long as there are no signs to suggest abscess of the breast. Kasi kung abscess, may nana, fluid din ang laman, pero nana ang laman. Hindi siya macrocyst. So ibang usapan yon, no? Fluid nga, pero nana, so we call that abscess of the breast. Kung fluid na hindi siya nana, then we call that macrocyst. So the other way of diagnosing macrocyst would be through an ultrasound, in which if you use this method, kasi ultrasound uses mga sound waves which creates echoes, no? Or no echoes. So pag may nag-produce isang picture na walang echoes, anechoic, no? Then that's a cystic mass. So clinically, okay, ito yung on this side of the slide, ito yung picture na different masses that we can experience throughout our lifetime or yung sa mga ibang pasyente, no? So kung abscess, ito yon, no? Nana ang laman. Fibroadenoma, solid siya, pero yung border niya, malinaw, no? Okay. So hindi, kasi kung cancer siya, usually rugged yung border. Andito, ito yung cancer. Rugged siya, no? Yung border no, yung edges niya. So once you have a solid mass na rugged ang edges, we suspect cancer. Okay? So cyst naman, fluid ang laman yan. Fluid. Okay? Of course, the fibrocystic walang talagang dominant mass, no? Mga baku-baku lang, no? Ganon. Okay. So there are other masses which we cannot include it here now. Okay. So, but these are the more common masses that one can palpate, one can encounter in life, no? In a patient with a breast. Ito yung illustration of what I call fluctuation. So it can be tested by placing two fingers of one hand. Okay, ito, two fingers over the mass, okay, somewhat apart on the mass. Then with the index finger of the other hand, yung pangalawang kamay, index finger, just ipindot lang. Pindot lang over the mass. Kung lumulubog, then that means most likely fluid ang laman. Okay? Yung fluid. Kung wala mo namumula, ganon-ganon, may infection, most likely it's a macrocyst. Kung may mapula-pula, masakit, no? Okay, most likely abscess, baka may nana. Okay. So, a definitive diagnosis is present when non-bloody fluid, serous, yellowish. When you say non-bloody fluid, could be serous and usually yellowish like this, is aspirated. And then there follows a complete disappearance or collapse of the palpable mass. Kanina earlier, my slide show yung physical exam. You can suspect already that you're dealing with a macrocyst if you have a cystic mass which is madidetermine mo by fluctuancy. Kung gusto mong mas sigurado, no? Okay, either you do an ultrasound, but you can also, ang pinaka most definite is that kasi ultrasound pwede magkamali. Ang pinaka sigurista na examination, you just poke in a needle, kung pinakuha kang fluid, that's it. No? Yun na yun, macrocyst. As long as the fluid is not bloody, is not red also. Okay. So what is the treatment of macrocysts? Just observe, watchful waiting for them to regress spontaneously. This is the rule. Pero kung malaki, you can do needle aspiration. If macrocysts are big and causing discomfort and pain, okay, because nagpe-pain lang because nadidistend yung mass ng fluid. No? So that's the most that you can do if you want to do something. No operation is needed. No operation is needed. So, importanteng malaman nito. Kasi pag hindi natin ninyo alam, sabihin sa mga doctor, kung a lot of doctors do not give you the diagnosis, sabihin, ay, baka cancer yan, operahan. No? Pero kung, if you know how to make a diagnosis of yourself, you know how to recognize macrocysts, no? Sabihin mo, tanong doctor, pwede bang i-aspirate na lang? You know, okay. So, no operation is needed for macrocysts. Then, no anti-hormonal changes, medications are given. No? Okay. So, importante malaman nito kasi there's still a lot of breast surgeons who prescribe a lot of medicine na kamahal-mahal. Kasi ang sabi nila, kasi ang paniwala nila, yung fibrocystic changes, macrocysts are hormonal related, kaya iko-contra nila with the anti-hormones, no? So sa akin, hindi naman kailangan yon, no? You just wait for that hormonal to change again, hormonal changes to change, hanggang mawala, no? So eventually, mawawala naman yan eh. You just wait, no? So you don't need to go to the prescription of anti-hormonal changes, which is, I'm telling you, no guarantee rin, mawala, no? And then, ang mahal-mahal, no? Okay. Can macrocysts recur after needle aspiration and operations? Dalawa yan, ha? Needle aspiration, operation. Yes. Okay. As illustrated in this SMAR, and as previously mentioned, okay, macrocyst is a recurring condition because of the hormonal changes and aberration in normal development of involution. Itong hormonal changes naman, hindi siya mawawala. It goes on throughout your life. No? It will decrease in intensity when you reach menopause. No? Yung aberration, tuloy-tuloy rin yan. No? Okay? So, nag-age tayo, nagmamature tayo forever. Diba? As to the day that we die. No? Okay. So, tuloy-tuloy lang yan. No? Okay, as illustrated in this MAR, yung pasyente na ito, 3 operations siya. Kaya nakita ko, nag-recur. Keep on recurring. Now, needle aspiration, I did several, nagre-recur din. No? So it will only stop when the right time comes, no? Menopause na siya, no? Okay. So the most that we do is just needle aspiration, no operations. If you just keep on doing the aspiration, marami ka ng peklat dyan sa breast mo. Okay? Tad-tad yan. So when do macrocysts stop recurring on their own? Pusa. Usually when the menopausal stage is reached, as illustrated in this mark. Pag menopause ka na, o baka na-operahan ka, tinanggal yung ovary mo, baka mag-stop na yan. Okay? So, my tips on management of similar situation, know what macrocysts are, tandaan mo yung what they are, know how to diagnose them. Madali lang i-diagnose yun, no? Most of the time. Ha? Kung alam lang ninyo yung basta fluctuancy, may fluid, macrocysts yun. No? Wag lang yung, solid. No? Okay. And then remember, a macrocyst is not cancer. I want to emphasize that kasi pag di nyo alam, kasi because of the fear of cancer, very common ang cancer, pag may bukol, baka cancer yan, baka cancer yan. So kung baka natatakot kayo, baka cancer, may nagsuggest lang sa inyo isang doktor na hindi rin sanay, opera ng opera lang, okay, opera natin. No? So you will fall trap into that suggestions. No? So remember, macrocyst is not cancer. Huwag kayo matakot. No? It is a benign condition related to hormonal changes. It can recur. Yun lang, downside then, it can recur and recur. Tanggapin na lang nyo, it's part of the life process, di ba? Okay, wala mang katapusan sa mga challenges, yung mga inconveniences that's occurring in our life, no? Okay. Pero ang consolation lang natin, hindi siya cancer. And then, it will stop recurring when the menopause is reached. Again, I would like to emphasize, no operation is needed. Marami ako nakikita ng opera, hindi kailangan, kaya napapaiyak din ako. Sabi ko, ano bang ginagawa ng ating mga kapwang doktor? Opera and opera. Okay. So at most, a needle aspiration can be done if macrocyst is big. Pag malaki na, let's say 5 centimeters, pwede nang i-aspirate. Kung maliit lang by mga 3, 1 to 2, pwedeng i-observe lang. 3 to 4, kung may symptoms, masakit, no? Pero yung sakit naman, kung minsan, you just wait for 1 day or 2 days, baka mawala rin yan. So you can just observe, no? Pero kung talagang mababa ang pain threshold mo, at talagang masakit na masakit, may discomfort, you can have it aspirated. Then the other key treatment strategy here is observation, and watchful waiting can be done for the small macrocysts. Okay? So, mas importante may observation, follow-up. No? And then, this is the last one. Regular monitoring and follow-up with the breast specialist must be done. Breast specialist dapat, para ma-monitor. And then, I want to emphasize this, huwag kayo kakagat dito sa mga prescription ng anti-hormonal change medications. Kasi a lot of our people, kababayan, medicine is medications, yan equivalent. Basta may gamot, maganda. Hindi lahat, hindi totoo, hindi kailangan. Okay? So kung di kailangan ng gamot, huwag inumin. Okay? Kung kailangan, inumin. Pero dito sa macrocysts, hindi kailangan. No? I think that was my last slide. Summary and takeaway. I have discussed all of these things. What is a medical anecdotal report? I've given a narration and an insight reflection. And then I won't repeat this anymore. That's the gist of my MAR, the summary. And then I discuss these items. What is a macrocyst? What causes and how they are diagnosed? And what is the treatment? And then can macrocysts recur after aspiration and operations? And when do macrocysts stop recurring on their own? Then I have given you my tips on management. So takeaway in relation to patient empowerment, be always in touch with reliable medical information on macrocysts of the breast. Management. Knowledge is power. It gives power. Use the 4 Ks of patient empowerment, kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions or make better decisions on management of macrocysts of the breast as part of your health management. This ends my pep talk today. Okay. I hope I have empowered you to have an essential understanding on macrocysts of the breast management as part of your health management. Reminder after the pep talk before we go to the QA, take the online learning comp evaluation test exercise for mastery of learning and have a perfect score to get a certificate like this one shown here. I have placed the link in the chat box, and then obtaining 25 or later certificates will entitle one mentee to a voucher for a free ROJoson medical consultation, either face-to-face or telemedical. Then request is type in your feedback in the chat box during the open forum and before we adjourn. Thank you. Let's now have a group picture taking before we start the QA and interactions. Okay. One, one, uh, 1, 2, 3. Ako ba lahat? Again. 1, 2, 3. Okay. The floor is now open for questions, comments, suggestions, and free consultation, short consultation. So since this is a breast topic, my son, Ray Benjamin Hawson, is present. She can also answer your concerns. Okay. Any questions? Baby Spirit 2 is here. I'm glad Baby Spirit 2. I invited 3 more, dalawang pasyente to attend. Si Carol Santos, hindi sila nag-attend. MACROCYSTS din sa kanila Abet, di ba? MACROCYSTS.
Ako rin, Doc.
Si Baby, sige, kasi para ma-share nila yung experience nila, MACROCYSTS, no? Baby, can you share your experience?
Doc, sa akin po year 1997. Then wala kayong pinagawa kundi aspiration lang. Hindi po ako mammogram and ultrasound. Basta aspiration, and then pag sinabi mong check up after 3 months, balik. Hanggang sa liliit, lalaki, magkakaroon yung kabila, mawawala. Tapos delete, lalaki. Sabi nyo, pag nag-menopause, mawawalan totally. Yun, nag-menopause ako, pero nag-check up pa rin. Last check up po, doctor, nung 2020 pa eh.
20?
January 2020, before pandemic.
Okay. Pero wala
Hindi na
na.
po ako nakabalik. Wala na
Wala
po,
na
doc. Ako na lang
wala na yung bukod.
nagsiself, self kapa.
Okay. Menopause ka na
Aha.
ngayon?
Apo, doc. 63 na ako, doc.
Kailan ka nag-menopause?
Naku, hindi ko na matandaan, doc. Pero yung ibang
Hindi
record,
ba
nandito sa
tinatandaan ng mga
akin.
menopausal? Di ba
Parang ano,
milestone yung,
doc?
ha?
Kasi iba ko record, nando sa clinic. Yung nandito lang hanggang
Hindi naman
1918
kailangan
lang eh.
record eh. Milestones yun, di ba?
Opo. Parang
Jeng, di
mga
ba? Jeng?
mga
Di ba? Pag
40,
may
mga
menopause kayo,
49, doc.
49.
Opo.
Okay. So, kaya nga yung age
Pero,
of menopause, iba-iba, no? Iba-iba.
pero wala na pong, hindi na po nagre-recurrent ngayon. Yun lang po, wala pong operation, hindi nyo tinatanggal.
Gaano
Basta,
kalaki yung tinanggal ko sa'yo?
parang minsan nasa 8.
Ha?
8 yata, yun, Dok eh.
8cc lang? Meron akong natanggal na mga 20, 30cc.
Oh, Dok, kasi iba na yung mga, ko rito, record ko, yung wala na kayong, parang wala na kayong, sa akin. Nandun sa clinic yung ibang record ko, Dok eh.
Yeah.
Kung
Okay. Hindi ko,
matandaan.
ako
Pa,
natatandaan ko kung yung umpisa, ang laki-laki. Di ba?
sa left, Dok, sa left. Pero
Laki-laki.
benign lahat.
Yeah, inaspirate ko lang, di ba? Tapos,
Opo, Dok.
may mga instances na ina-aspirate ko, walang fluid, pero maumbok.
Oho.
Di ba?
Wala po.
Okay,
Opo, Dok. Mhm.
so yun yung sinasabi ko, importante yung breast specialist, no? At
Oho.
importante, yung breast specialist ay medyo mabusisi, na babantayan lang, no? Wag lang
Sa
kasi
inyo po ako agad kasi nagpunta mo nung mayroon akong naramdaman eh. Sabi ni Doktora Salonga, puntahan ko na agad kayo.
hindi ka naman pumunta sa ibang ano,
Wala
napupunta.
po akong pinuntahan
Kaya nga,
kayo
yung
lang.
sinasabi ko lang, kaya marami rin ako nababalita na opera na di oras, no? Yung mga
Opo.
macrocysts na hindi naman kailangan, no? Kumisa
Mhm.
kasi Kamisa naman, basta kung meron kang yung doktor, kung may duda na it's not macrocyst, yeah, pwede niyang operahan, no? Pero
Oo, Dok.
kung more or less sigurado na siya na macrocyst, pwedeng i-observe lang or aspirate, no? Aspirate.
Oo.
Magtiyagaan, dapat magtiyaga lang, no? Tiyaga lang yung
Opo. Saka
doktor,
pag
tiyaga lang
sinabi
yung
niyo,
pasyente.
pag sinabi niyo pong check up after 3 months, pupunta ako, Dok.
Yan ang gusto ko.
Oo.
Okay?
Mhm. Ay, mga ganyan, Dok. Sorry, hindi na ako nakakapunta. Kasi
Okay
lagi
lang.
kang puno. Laging
Oh,
puno yung ano mo, appointment eh.
hindi pwede kita mang isingit
Naiiyak ako, Dok.
Wala.
Kasi pagdating ng 12:30, kailangan nasa clinic ako eh. Meron kaming clinic ng 1.
Hindi gawin
Sige,
natin,
minsan
gawin
dadalaw ako
natin 7
ulit.
o'clock.
Dumadalaw ako sa inyo, Dok, naman eh. Nag-hi.
Oh, sige.
Pero, Dok,
Okay.
thank you, Doc. Thank you,
You're
thank you.
welcome. So, yung kay
Uh-huh.
Baby Spirito, it's a illustrate, actual live illustration of a patient with
Uh-huh.
macrocysts, hindi na operahan, paulit-ulit lang, no? So,
Opo. Walang mammogram and ultrasound kayong pinagawa.
uh, okay.
Check up lang. Opo.
Check up, check up. Okay.
Uh-huh. Thank you,
Okay,
love. Thank you,
pagtiyagaan
Doc.
lang then trust your
Opo, Doc.
doctors, then
Uh-huh.
control your anxiety. Control niyo yung anxiety kasi sabihin niyo, bakit pa ulit-ulit? Di ba? Kung minsan naiinis kayo, di ba? Okay,
Doc,
paulit.
yan ang iniwasan ko yung stress para wag maano siya.
Kaya
Kaya ako
yung sinasabi
nagano.
ko nga rin, may mga pasyente naiinis kasi paulit-ulit na gusto nilang patanggal na. Meron isang
Uh-huh.
pasyente na gustong patanggal sa akin. Sabi ko, ayoko, it's against my belief, no? Sabi ko, hindi naman
Uh-huh.
kailangan operahan. Bakit kita operahan?
Uh-huh.
Bas, ito lang ba ako? Yan ba gusto ko? No, hindi.
Uh-huh.
No? So, I think
Opo.
pumunta siya sa ibang doktor. Inoperahan ng ibang doktor. No? Okay.
Oo.
Kahit na in-explain ko sa kanya, paulit-ulit lang talaga yan, no? Pero benign lang yan, hindi kailangan operahan. Kasi ganun yan eh, pag, di ba, fluid ang laman? Fluid, di ba?
Doc.
Meron siyang balot, may capsule.
Opo.
Pag inoperahan
Tuloy lang.
mo, sa hindi mga doktor dito, makinig kayo. Pag inoperahan mo, hindi mo maiwasan na mabubutas mo yung cyst. Parang balloon yan. Balloon. Na? Pag nabutas mo yung cyst, puputok na yung cyst. So
Mhm.
yung tubig, aapaw, lalabas sa sugat. Wala ka nang matatanggal. Di ba? So ang
Ah,
ginagawa ng ibang doktor kasi na-operahan na, may tatanggalin ng konti para masabi lang may nakuha. Pero actually, pumutok na yung cyst during the operation. So sayang. Okay. So doon ako natuto noon. No, nung umpisa, naranasan ko yon. Nag-opera ako noon,
Ay,
nung
serious.
inoperahan ko, naputok. Ano pang tatanggalin ko? And then naawa ako sa pasyente. Sana hindi ko na inoperahan. Sayang. So this time, ina-aspirate ko na lang. No? Aspirate na lang. Aspirate and aspirate. No? Okay?
Mhm.
So remember that, number one, know what a macrocyst is. Kung macrocyst, more or less 99% sure kayo macrocyst, no, with the confirmation by your doctor. Okay? Huwag kayo matakot. No? Don't equate, huwag niyo sasabihin na it can become cancer. No, it will not become a cancer. Okay? Huwag niyo pa-opera. Kung may nagsuggest sa iyo na for operation, huwag niyo pa-opera. Okay? And then, bantayan lang ninyo. Keep on watching it. No? Okay? Okay? Sino pang may tanong? Kay Jeng, si fibroadenoma kay Jeng. Diba? Solid.
Yes po,
No?
Doc. Mhm.
Okay. Walang may macrocyst na. No? Okay. Any more questions that you want to ask on macrocyst? Imelda, you have something to ask? Imelda, meron kang tanong? Unmute yourself. Macrocysts can occur at any age. Usually mga medyo may edad na 30 to 50 years old, no? Pero kaminsan 64, kanina may na-opera ako kaya ako na medyo na late, nakahabol pa ako pag-uwi, no? No. 64 years old, may macrocyst din siya, pero yung macrocyst niya may kasabay ng cancer, may kasabay siya ng cancer, no? Kaya inopera ako, no? Imelda, you want to ask something? Oh, May Ann. Meron kang free consult, May Ann. Wala, tulog. Baka tulog si May Ann.
Di po.
Doc, tanong ko lang
Ah,
po yung office mate ko, si Jen, kung kailan po ka-operation.
ha?
Jen Andam.
Sino
Si
nagtatanong?
Jen
Okay, si
Andam,
Melda.
pupunta
Si
na po
Melda
kayo
yung
po sa operation niyo.
Oh, tapos na. Tapos na. Kanina.
Yes, Doc.
Oh,
Tapos na.
tapos na. 7 o'clock
Okay.
up to 1.5 hours ako doon. Si Jen, tapos
Okay.
na. Nasa kwarto na siya.
Sige, Doc.
Dalawang inoperahan ko kanina. Isa si Jen,
Nasa kwarto na.
isa yung mas matanda. Medyo nahirapan ako dun sa matanda kasi mahirap i-diagnose. Yung kay Jen kasi meron na siyang biopsy. No? Okay. Okay. So, kumusta ang papa mo? Ay, nanay mo. Naopera na. Okay na.
Ah, na- nan- Nandito po kami ngayon sa hospital.
Nasa
Naka-confine po
hospital
siya
pa kayo?
na-opera na po.
Sa hospital pa kayo?
Yes po.
Okay. So, okay na.
Yes po sa
Pauwi na
PGH.
kayo.
Charge po kami sa Monday.
Okay. Okay. So, any more? May tanong ka, Mayan? Jose?
Hindi naman siya macrocyst. Bali, ano po yung doc, yung sabi ko sa inyo, October 2 po, habang naliligo ako, may nakapapo kong buko sa ilalim ng dede ko.
Sige,
Minsan,
patingin mo na. So, hindi siya macrocyst.
hindi po.
Kinapa mo, solid siya.
Minsan matigas, minsan malambot, paikot-ikot, minsan umiikot, minsan sa kaliwa po, minsan sa kanan. Yung nagsusway po siya, pa iba-iba na lugar.
Gaano kalayo ang sinusway niya?
Yung ano po, yung minsan, di ba, sa gitna po minsan lumilipat do sa gilid, minsan nasa ano, kumbaga gumagalaw po siya, hindi siya nakastay lang sa isang position.
Hindi mas maganda yon. Mas maganda yon, pero it has to be checked by a doctor. Kung sinasabi mong movable, layo namang pinupuntahan niya, 2 centimeter from one side to another one, maganda yon, no?
Ah,
Pero at your age and with your history, pa-check mo na kagad, ha? Baka, let's hope it's something benign, no?
fingers
Okay.
crossed.
Basta hindi siya cystic. Hindi siya cystic, solid siya.
Opo.
Okay. So, kung solid, mas nakakatakot compared to cystic. But not all solid are cancer. Majority are still not cancer. No? Okay.
Okay po.
Okay.
Thank you po, Doc.
Wala na. May tanong pa? O, Belet. Si Belet, may tanong ka, Belet?
Doc, pag po yung bukol parang mahaba, yung parang hindi naman bilog, paano po yun? Parang
Mahaba.
nakikita
Kung
ko sa...
talagang mahaba, na parang, what do you call that? Elongated, now most
Aha.
likely fibrocystic lang yon, na makapal lang, makapal, hindi talagang bukol, no?
Parang meron sa may
Usually,
bantang taas ng kilikili.
yeah, usually yung mga bukol ay talagang parang oval, hindi sila
Oo.
perfectly round, no? Hindi
Mhm.
sila round, minsan oval lang, no? Okay.
So, may
Pero
nakakapahaw kang ganun din.
yung pahaba, kung may pahaba kang nakakapa, baka hindi siya bukol. Parang may mga hormonal changes lang, no? Okay.
Mhm.
Okay?
Sige po. Thank you.
So, kung wala nang tanong, Ray, Benjamin, may dadagdag ka?
Wala. Parang nasabi mo na lahat. Parang yung macrocyst kasi, parang yung breast cyst ay parang isa sa pinaka-common na benign conditions ng breast. Parang kung fibroadenoma pag solid, yung cyst sa pag fluid. Pero yun, hindi kailangan mag-alala kasi hindi siya cancer. Tapos di rin kailangan operahan. At most aspirate talaga kung symptomatic. Pero most of the time yun, mawawala talaga siya pag menopause or less o pag after menopause due to the hormonal changes. Yun lang.
Okay. So, madalas ba ginagamit yung term na yun sa Singapore?
Hindi. Cyst lang. Breast cyst lang. Hindi macrocyst.
Yung breast cyst, pag sinabi yung breast cyst, malaki.
Kahit anong size. Hindi ginagamit yung macrocyst masyado.
When do they use fibrocystic?
Fibrocystic. Actually, hindi sila masyado nag-diagnose ng fibrocystic. Unless, biopsy. Sa biopsy.
Okay. Nakikita niyo, iba-iba, no? Iba-iba yung gamutan, no? Okay.
Hello,
Sa
sorry.
akin, ako nag-invento ng fibrocystic. Actually, hindi naman ako ginagamit ko yung fibrocystic para to help patients understand what their condition is, no? Okay. Para meron silang isang nahahawakan ng pangalan ng isang kondisyon, no? Okay. Kasi dapat i-explain mo pag meron kang nakita sa isang sitwasyon sa isang pasyente, you have to explain everything, no? Okay. Hindi naman lahat ay nakita mo ay sakit, di ba? May mga tinatawag na medical conditions, no? Parang makapal lang, masakit lang, no? You just have to make a explanation, pero kadalasan you have to put a name to that condition. Yung ginagamit ko yung fibrocystic changes when it refers to hormonal changes, no? At usually yung cyst na sa fibrocystic, yan ang microcyst, no? Okay. I think ilan lang nakita kong journal sa Mayo Clinic, I think they use that. In-explain niya, no? Yung cyst sa fibrocystic are the microcyst, micro, no? Okay. And then only a few surgeons, only a few sa literature, konti lang gumagamit ng macrocyst, no? Okay. So,
Yeah. Dito hindi masyadong ginagamit yung
hindi
macrocyst
ginagamit,
kasi.
no? Yeah, that's one of the kaya importante yung mga patient empowerment program. Dapat alam niyo kung anong nangyayari, no? Okay, anong trend. Kasi kung di nila ginagamit, ang gagamitin na lang isang sakit ng isang pangalan ng isang sakit na talagang mas grabe. Kung kaya na-opera na di kagad, no? Na di oras, no? Okay. Okay. Okay, kung wala nang tanong, we'll call it a day. So, ano bang next week? We'll go on thyroid next week. No? Thyroid. Another MAR. No? And probably that will be the last MAR for the year. And then after that, we'll be talking about yung mga ibang topics na like what to do if there's a cancer in line with our Cancer Crusaders Club. Now I will be discussing if there's a cancer diagnosis, what will be the next step? What will you do spiritual wise? Kung anong gagawin ninyo, no? Then the other one will be what to do malapit na mag-Christmas, what to do when there is ano yung mga dangers during the New Year's Eve, no? Okay. So ingat-ingat lang, no? Okay? So the next topic will be thyroid, isang MAR pa next week. Okay? So let's
Okay,
call it
Doc. Thank you.
wala na. Let's call it a
Thank you
day.
po.
We'll see each other next week. Bye-bye.
Thank you po, Dr.
Bye po.
Happy weekend.
Bye po.
Kayo rin.
Thank you po.